Hi, this recording will go over how to avoid reading into questions, some test-taking strategies for specifically multiple choice and select all that apply questions, as well as some math practice. Your textbook talks about the ingredients of a question or the different parts of a question. The textbook describes the case event, which is the heart of the question, and contains relevant and irrelevant information. So sometimes NCLEX style questions contain lab values, background data, vital signs, things that don't really help you select the correct answer. So that would be the irrelevant data. And the relevant data is the content that drives you or helps you figure out the correct answer. So the textbook calls it a case event. I call it a scenario. So the question scenario. Question query then is the specific question. I personally just call it a question. And then options. So for multiple choice, there's one correct answer option and then 3 distractors or incorrect answer options. Your textbook provides you with a great list of strategic words and phrases that will help you use test-taking strategies to answer questions correctly when you practice, I guess is what I'm trying to get at. So strategic words: best, first, highest priority, next, initial, immediate. Some of our previous rewording activities, I was sure to note like, hey, good job in keeping the word immediate in there. Or I'm glad that you used priority instead of immediate. The same type of strategic wording when you do reword a question. So when you're reading over a question, look for these strategic words and then include them in your rewording, because they will help you cue you into some test-taking strategies you need to apply. Other strategic words: early, late, need for follow-up or need for additional teaching, or increased or decreased. So the subject of the question, what's the question asking? And we've been practicing this already with our rewording activities. A little side note there, you may see questions with content that you're not super familiar with. So NCLEX style questions aren't black and white, right? Usually not knowledge-based questions, so they can be a little bit more challenging than other types of questions you've experienced in college. What you want to do is not freak out if you have a question about something that you don't quite know 100% or you're really not familiar with it. You want to stop, take a deep breath, relax, focus on the subject, and use your knowledge, your nursing knowledge that you have to answer the question correctly. An example would be, I teach about chemotherapy, but I do not require students to memorize any specific chemotherapy prototype medication. So I may give an exam that lists an actual chemotherapy medication, and students can be like, she didn't tell us that this med would be on the test. Well, you're able to answer the question based on the general knowledge about chemotherapy medications that I taught you. So don't get thrown off when you see something that's really not familiar to you. Take a deep breath, think about what you do know about the content area, pick the best answer option, and move on. Process of elimination can be used with both multiple choice and select all that applies questions. So you want to read the question and reword the question, including any strategic words that might be in there. Think of what might be the correct answer before you even look at your answer options. Then read all the answer options. Don't stop at A because A sounds good. Read all the answer options. And it's good to get in the habit of identifying answer options as either assessments or interventions. This won't apply to all. Sometimes it might be a question about a med and it's only side effects listed. But a lot of NCLEX style questions, your answer options are either assessments or interventions. And it helps to identify whether it's an assessment gathering data answer option or an intervention doing answer option. That can be helpful. Eliminate answer options that you know are not correct, and then pick the best answer based on your nursing knowledge and your test-taking strategies. Determine if an abnormality exists. Look at the data in the question and determine if anything's abnormal. Focus on the data in the question and ensuring client safety. So focusing on the data is, what is the question asking? We've been practicing this with our rewording activities. A second thing to consider is patient safety or client safety. And we'll talk about that in the near future, about where that sort of answer option that involves safety would be prioritized. Focus on the client in the question. This is a big tip for communication type questions. We are client or patient centric, so when we're answering these types of answer or NCLEX style questions, we're going to be focusing on the client. Sometimes you have answer options that talk about like the client's coworkers or the client's mother, and usually it's the client specific answer option that would be right. Finally, consider all available resources. In NCLEX world, everything is perfect. So I have had students in the past say, I wanted to give the patient morphine. I could tell they needed pain meds, but I wasn't sure if I had an order, and I can't give a pain med without an order, so I didn't pick morphine. So in NCLEX world, you have the order for morphine. If the answer option is to give a med, it's a perfect world, the order exists. You have to decide if that's the correct med to administer. If the answer option is to start an IV and start fluids, you have the supplies for the IV, the order for the IV, the order for the fluids, all the bags, the tubing, everything you need. You just have to decide if that's the right answer. I commonly hear from students, I narrowed it down to A and C, but I picked the wrong one. So the ability to narrow it down to the top 2 answer choices, but then not be able to pick the correct answer is problematic and frustrating. So when you make your final choice, focus on what the question is asking. Use your nursing knowledge and implement the test-taking strategies you're going to learn in this course. Pick a correct answer and keep moving forward. What if syndrome? Don't ask yourself, what if, but what if when you're taking an NCLEX style examination. So a lot of times you're reading a question and you start using this clinical judgment that you're developing in nursing school, and you start thinking about different scenarios and how that could impact which answer is correct. So what if they're also experiencing this? Or what if the vital signs look like this? Or what if the medication, this is the medication they've been taking. You can't do the what ifs. You can only make your answer selection based on what's presented in the scenario. Don't ask yourself what if or start thinking different scenarios that could affect the answer. You're going to take yourself down a hole and end up picking the wrong answer because of it. Read the question, focus on strategic words, focus on the subject of the question, and then think about clinical judgment you need to apply to answer the question correctly. We've gone over some strategies for attacking multiple choice questions. Just a reminder, they're either 0 points or 1 point. If you get it correct, you get a point. Most people are familiar with multiple choice questions from previous types of examinations in different college courses and in high school. I think that's really it for that one. For select all that applies questions, when you're answering one of those types of questions, you want to approach it as if it's multiple choice questions, So you read A, look at answer option A, is it true or false, select it or don't, and then go to B as if it's a different question. Sometimes I think students get overwhelmed by the thought that it's select all that apply. Really the way that the next generation NCLEX grades these, they're almost like individual. For each correct answer, it's like an individual multiple choice question. In the past, select all that apply were all or none. Either you got a point for it or you got 0 points. With next gen NCLEX, it was changed so that students could get partial credit. So let's say if there's 4 correct answer options and you put 3 of the 4, you would get 3 out of 4 points. In the past, you would get 0 points because you didn't get all 4 correct. You'll have to talk with your nursing instructors to find out if they're using partial scoring on select all that apply or using all or none scoring. The NCLEX is using partial scoring because the powers that be who are creating that exam thinks that partial scoring better reflects a student's knowledge of the content. For example, if I answer a question and get none of the answers right, and you answer a question and get 3 of 4 correct answers correct, you get 3 points, I get 0 points, and it better reflects your knowledge of the content. All right, we have 2 practice math questions. So I'm going to read the question, then you're going to pause the video, and then on a scrap piece of paper, work out the math, and then resume the video and see if you got it correct. So the first math question, how many tablets will be administered for the following order? Levothyroxine, 0.2 milligrams PO daily, and you have a label there to help you solve the problem. So pause the video so you don't hear the answer and work it out on your own, and then resume the video to see if you got it right. All right, for this question, it's asking how many tablets. So I start by putting what my label is going to be at the end so I don't accidentally solve for the wrong thing and not get my points. So I'm solving for tablets. I start with tablets. I look back to my provided information and see what do I have. I know that I have one tablet is 100 micrograms here. So one tablet paired up with 100 micrograms. I know micrograms needs to be on top of my next fraction, but my problem has milligrams. So I use a conversion fraction, 1,000 micrograms over 1 milligram, and now I can put milligrams on the next fraction up top, and I bring over my 0.2 milligrams, and that's per dose. The micrograms and the milligrams cross out, and I'm left with tablets per dose, which is what I'm solving for. I do the math, I end up with 2 tablets. So I write my 2 there. I'm not done yet though. I need to go back and see if that answer option makes sense. So 2 tablets would be 200 micrograms. I could move my decimal over 2 spots, 1, 2, 3 actually spots, and get the 200, or do a conversion to say, yeah, that makes sense. 2 tablets is 200 micrograms, 0.2 milligrams. Next math question is how many milliliters will be administered for the following order? Penicillin 0.25 grams, and you have your label there. Pause the video so you don't accidentally see the answer before you work it out. All right, let's see if we have the same answers. So we're solving for milliliters. I start with that, and then I bring it to the front. I look at my problem and see what do I have in milliliters. I have 5 mLs paired with 250 milligrams. I know my next fraction on top has to be a milligram, but I don't have milligrams, so I need a conversion to get me to grams. 1,000 milligrams over 1 gram. Now I can bring my 0.25 grams over here. Remember, you have to have a 0 before the 0.25, because if it just said 0.25, it'd be more likely to have some errors. So the 0.25 is necessary, and that's over 1 dose. My milligrams and grams cross out. I'm left with milliliters per dose, which is what I'm solving for. I do my math and I get 5 mLs. I write my 5 mLs up top. I'm not done yet. I need to make sure it makes sense. 5 mLs is 250 milligrams. 250 grams, if I move my decimal 3 spots, is 250 milligrams. I know that's correct, or you could use a conversion. Make sure it's correct. Make sure it makes sense. Because let's say I got 500 milliliters. I could come here and say, whoa, I know that's not right. I probably have a decimal in the wrong spot. I made an error somewhere, and I need to go back and fix it.